Welcome to my channel. Do you know that every year approximately 20 million people are affected by various types of cancer? Among them about 9 million are women. Breast cancer is the most common type of cancer worldwide. When it comes in fertilities, cervical cancer suppresses the breast cancer. Therefore, the risk of death is significantly higher if cancer occurs in the cervix. According to the research of World Health Organization, around 342,000 women die every year due to the cervical cancer. Among them, 90% are from low to middle income countries. Cervical cancer can be prevented very easily. Cervical cancer detection tests are being conducted free of charge in all government hospitals across the country at the Upazila district and divisional level. This test is known as the VIA test. Through this test, it is possible to detect in advance if there is a possibility of cervical cancer. So, in this video, I will discuss about what is the VIA test, how is the VIA test performed, and who should urgently undergo the VIA test. Number 4. How will you understand the VIA test report? What should you do if there is a problem in the report? So, let's get started. What is VIA test? The full form of the VIA test is Visual Inspection of Cervix with Acetic Acid. Please look at this image. This is an image of female reproductive system. The part shown in the picture is called the vagina. The name of this part is the uterus. The smooth part between the vagina and uterus is called the cervix or cervical canal. Cancer of the cervix is called cervical cancer. VIA test is done for the scanning of cervical cancer. Through this test, any significant change in the cell of the cervix can be observed. Therefore, through this test, it is possible to detect cervical cancer before it occurs. Number 2. How is the VIA test performed? For this test, the patient is first counseled. There is no pain or discomfort associated with this test, and no anesthesia is required. Initially, the patient is positioned in the specific way. Then a device called a vaginal speculum is inserted into the vagina, allowing easy visualization of the cervix. After that, the inner part is wiped with a cotton swab. Once the swabbing is complete, a liquid solution of 5% acetic acid is applied to the cervix using a brush. After waiting for 1 minute, the doctor examines whether there are any changes in the cervix. In this process, the early stage of cervical cancer can be diagnosed. How will you understand the VIA test report, and what should you do if there is a problem in the report? After the examination, a report will be provided, usually on the two types of paper, one blue and the other red. On the blue paper, if the report indicates negative, you will understand that the VIA test is negative, meaning there are no abnormalities detected. If the report comes on the red paper, when you will understand that the VIA test is positive, indicate that there is a problem. However, it is important to note that a positive VIA test does not necessarily mean cancer. If your VIA test result is positive, it is crucial to consult with a gynecologist immediately because further tests will be required to confirm or rule out cancer. Therefore, if you receive a positive VIA test result, seek advice from a gynecologist without delay. Who should undergo the VIA test urgently? Number 1. According to the World Health Organization, all women between the age 30 and 60 should be undergone the VIA test every 3 years. Number 2. Those under 30 but recommended by a doctor. Number 3. Individual experiencing pain or bleeding during or after sexual intercourse. 4. Excessive and unusual vaginal discharge, bloody discharge or foul smelling discharge. Number 5. Excessive bleeding during menstruation or bleeding after menopause. Number 6. If pain in the pelvis area. If you experience any of these symptoms, it is crucial to consult with a healthcare professional and consider undergoing the VIA test. Where can the VIA test be conducted and how much does it cost to undergo the test? The VIA test can be done at all government district, divisional and regional hospital free of cost. To prevent cervical cancer, undergo the VIA test every 3 years at no cost. Stay healthy, stay cancer free. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.